Good morning, Maryland. I'm Christian Schaefer here on the Day of Answers for WMAR 2 News and GBMC. And today we're talking about the flu with Dr. Jasmine Manley, who is a doctor of internal medicine at GBMC. Dr. Manley, thanks so much for coming in and talking with us on. It's an important day, and I always want to make sure that the viewers are kind of with us and in tune with where we are doing this Day of Answers about the flu at this time. There may be some people who are saying, isn't it a little early for the flu? Not the case, right?
No. Here, kind of in the northern hemisphere where we live, flu season is from October through May. But patients can get their flu shots starting from now. A lot of clinics, including our clinic at GBMC, we're giving out the flu shot now.
So at a minimum, it's a time to start thinking about when and where and how you're going to get it for you and the kids.
Exactly.
Yeah. And who should get the flu vaccine? I mean, we're talking about everybody is better off getting it, right?
Yeah, so the medical community pretty much feels that everyone over the age of 6 months should be getting their flu shot. And more specifically for patients who have a low immunity, or they're very young or over 65, pregnant women, patients who, have HIV, chronic medical issues. Everyone should get the flu shot, healthy patients too.
Now, if you guys have any questions, feel free to send those in through the WMAR 2 News Facebook page. And people do have a lot of questions about the flu shot. I think the main one, if it's not the main one, maybe it should be, is the flu shot effective? Does it prevent the flu?
Yes, so the flu shot is actually one of the best things that we can do to prevent getting the flu during the winter months. When they decide what flu strain should go in the vaccine, they look at what strains have been causing people to be sick in the previous flu season. So hopefully the whatever strain is affecting us this season will match what's in the vaccine and will be covered.
So it's possible that it may not provide 100% protection.
Oh yes, it is possible, but studies have shown that even if it's not a perfect match from what's in the vaccine to what's affecting people this season, there's such important prevention of morbidity and mortality in the population as a whole. And
unlike some vaccines you get as a child, this is something that people get every single year.
Yes.
Why is that?
So studies have actually shown that as we get the flu shot consecutively, you actually build up more of an immunity to the flu. The flu is a very fast-changing virus. It can mutate, and so every year you might get different variations of the flu, and if you get your flu shot every year, you kind of build up a stronger defense for years to come.
Right, so it's a good idea not just to get it this year, but to think about
every year.
Yeah. And some people, after they get the flu shot, whether it's in their mind or whether it's in their body, they feel sick. And so they start to feel like, oh, I wish I hadn't got this because now I have the flu. That seems to be the refrain I hear from some people when they talk about the flu shot. That's not exactly the case though, right?
It's not exactly the case, but we won't, poo-poo that either. I will say that the flu vaccine absolutely does not cause the flu. Sometimes what happens is that we get the flu shot, and it takes about 2 weeks actually for our immune systems to build up a defense against the flu. So they could theoretically get infected within that 2-week period and develop the flu. But also, like I said before, the vaccine doesn't cover 100% of strains that could possibly affect us. So you could be infected by a strain that's not covered in the vaccine.
But that's another reason potentially to think about getting the flu shot rather early in the flu season, because it doesn't take effect right away.
Right. So that's why even though the flu season is October to May, it would be good to get it earlier.
So it takes 2 weeks to get to it's fully effective.
Yes.
Wow. Is there anybody out there who maybe should not get the flu shot? I mean, is there anybody not qualified for it, or who should be thinking about it that way?
Well, that's a good question. So some people, the way the flu vaccine is made, it's derived in culture fluid from chicken eggs. So sometimes people say, well, I have an allergy to chicken or chicken eggs. And while it's true that, the flu has chicken protein in it, unless you have a severe anaphylaxis type reaction to chicken eggs or chicken, you should get the flu shot. If it's a rash or something mild, that's not a contraindication for getting the shot. There are different types of flu shots. Most commonly, it's a killed virus shot that's being given, but sometimes there are live virus vaccinations, and that doesn't mean that the virus you're giving patients a live virus. It's just meaning that there's only a small part of it from the virus and no potential to get the flu. But in patients who are immunocompromised, they should not get the live flu vaccine. They should get the killed flu vaccine.
And like other vaccines, basically it's letting your body understand what could be coming this winter. And it learns how to fight it.
It's building up defense mechanisms so that we can fight the flu if we get it.
And there's been several years where there was a flu mist that people would get. And then I feel like it went away for a while, or people were being recommended not to get it, or that they say, don't get the flu mist, always get the flu shot. Where are we at in 2019 with the flu mist?
So the flu mist, the intranasal spray of the flu, it's around, but we still kind of recommend not getting that. There's some issues sometimes with how effective can we build up an immune response with that modality, and do we get enough protection? Because you have to spray it in your nose. Sometimes people are sick at baseline and they can't get all of the vaccine through that.
Whereas when you get the shot,
it's right in the muscle.
It's all going in.
Yeah.
Corey is asking if she got the flu shot last year.
Yeah.
Does that protect her at all, or is she at risk at getting the flu this year, or is it really that important to get it again?
That's a really good question. So when we get our flu shot, over time, over a period of about 6 months, we tend to drop in the immunity that we have against the flu. So that's one reason to continue to get a flu shot every year. But then the other reason is that strains from last year's flu shot may not be what's in this year's flu shot, and that's actually the case this year.
We get a lot on these discussions as I'm joined here by Dr. Jasmine Manley from GBMC, and we're talking about the flu here on our Day of Answers. A question that we get a lot has to do with natural remedies. And I have a question from Aston, who is saying he takes some vitamin D3, he takes some vitamin C, he takes some elderberry syrup. He's never gotten the flu. Is that a coincidence, or is that just one of those things where maybe some of those natural remedies do have an impact on your health?
No, I mean, anything that you're doing to maintain a healthy lifestyle is going to be great, because the folks who, most healthy folks, even if they do get the flu, they can clear it on their own. But the folks who have chronic diseases or lower immunities, those are the folks that can have serious side effects of the flu. So anything you can do to keep yourself healthy is great, but getting the flu shot remains the number one thing you can do to prevent the flu.
I still feel like some people are equating it with the cold, and they feel like, oh, I don't need to get the flu shot because it's not that serious anyway. If they've had some sniffly, runny noses, whatever, but they may not realize that you didn't have the flu, and if you got it, you'd know. It seems like, I'm not sure if people always understand that it is much more serious than the common cold.
Yes. So the common cold and the flu, they're all viruses that kind of rear their ugly heads during the winter months.
And they come out at the same time.
Yeah, exactly. So, and they have a lot of symptoms that are similar. But with the colds, where it's kind of, restricted to the upper respiratory tract, you have cough, sneezing, runny nose. You get that in the flu, but you also have systemic symptoms like fever, muscle aches, headaches. You just feel lousy, fatigue, and that can last for a little bit longer than the cold.
So in your practice, you've seen patients who've gotten the flu and who need to come to the hospital.
Yeah.
I mean, these are patients beyond, where they could just have some chicken soup and get better in a few days.
Right.
When do you know that it's gotten that bad and you really need to look for some help at that point?
Yeah, so one of the major complications for the flu is pneumonia, or like a lung infection. And if you see signs that you've been diagnosed with the flu, or you feel like you've gotten the flu, and you're starting to get better, and then you start all of a sudden starting to get fevers again, chills, you're starting to feel a little worse, you're coughing, you're bringing up a lot of phlegm when you cough. Those are signs that there might be either a pneumonia from the flu, or because your immune system is fighting the flu, it can't fight other bacterial infections causing pneumonia.
So sometimes those are related.
Right.
For parents, do you want to, how do you know when you should keep the kid at home from school? We're getting ready to head at the cold and flu season. The child might wake up one day with a fever or with some other symptoms. What are some of the things that you should think about as far as, okay, you can go to school, or I really ought to keep you back today? How do you make that call?
So if your child has a fever, you should probably keep them out of school. Absolutely. You should, if you've been diagnosed with the flu, the CDC recommends that you stay out of school, work, don't do errands for at least 24 hours after your fevers have subsided. And that doesn't mean you took Tylenol and your fever subsided. No Tylenol, you don't have a fever, 24 hours after that, you're okay to go back to work or to school.
Which could wind up being even an extra day than you might think.
Well, yeah, because the flu course can run from about a week to 10 days, sometimes even longer. So it really depends, not necessarily on the duration, but when did you stop having the fever, and then 24 hours after that.
Alexa is wondering about those symptoms that people get from the flu shot, and it's something that we do hear a lot.
Yeah.
And you were saying that in many cases that may not even come from the shot itself. It may be that you picked up a mild strain of the flu as you wait for it to take effect, but it's that timing. Right.
The most common side effects from the flu are just pain, tenderness, swelling at the site of the injection. Some patients, particularly children, can get like GI symptoms, nausea, vomiting, sometimes diarrhea. But those symptoms, and some patients can even feel a little, have a low-grade fever, and all of that is just the immune system gearing up to make you protected against the flu. But those symptoms last for about 1 to 2 days. They are so minimal compared to if you actually got the flu.
Right. Now, some people have never gotten the shot and may have never also gotten the flu. So I don't know if they feel like they're knocking on wood, or they're just lucky getting through every winter without getting it. But how do you approach someone like that? Say, well, maybe I should get it this year. How do you make that argument?
So I try to lean towards, the Good Samaritan in them, because even if we don't get sick, some patients get the flu and have really mild symptoms. But, when we get vaccinated, we're actually protecting other people in our community who are more vulnerable and would, really experience a lot of harm with the flu. So our pregnant folks, the children that we're around, our elderly folks, the folks on dialysis or who have transplants, HIV community, we're really protecting them, because when we get vaccinated, then we're less likely to spread the flu to them.
How easily does the virus pass between people? I mean, can it sit on a bathroom counter for a long time? Are we okay if you're washing your hands more often? Is that good advice? Like, how long does it survive in between people?
Yeah, so usually the main mode of transmission is through respiratory droplets. So if I sneeze or if I cough, I'm spraying my surrounding area with droplets with the flu virus, and that can go up to 6 feet for large droplets, or even farther for smaller droplets, and that can also go on surfaces. And flu can live on surfaces for quite a few hours.
Hours.
Yeah, hours. So if anybody sneezes here, and then later on somebody comes and touches the table, and then touches their eyes, nose, or mouth, they can get the flu.
That's how you get it.
Yeah.
And so, and you would never, how long would it take then to manifest itself as the flu? A couple days or?
Yeah, so the period between getting infected with the flu and symptoms ranges like 1 to 4 days, but for most people it's about a day and a half.
Day and a half.
Yeah, but you're actually infectious before you get symptoms.
Really?
So another real important reason to get your shot.
And by that time you'd have forgotten which bathroom counter you touched.
Right,
by that
absolutely.
So, yeah. So you're better off just getting the shot in the first place. And another, Caitlin is asking about that flu shot. If you do wind up getting the flu, how does it that having the shot would decrease the severity of the flu if you get it having gotten the flu shot?
Yeah, that's an
that
excellent question. So if you were to get the flu and you had your flu shot, you're actually less likely to need to go to the hospital or suffer from these serious complications of the flu. So you may, and your symptoms might be a little bit milder as well.
Which is good.
Yeah.
If you were to experience the really bad ones. What about women who are pregnant?
Yeah.
Does it matter how far along they are, or should any pregnant woman also be getting the flu virus?
Absolutely. Any pregnant woman, whatever trimester they're in, should be getting the flu shot. Even women who have had a baby and they're 2 weeks postpartum, they should be getting the flu shot as well. Because the great thing about that is that it reduces hospitalizations and complications for them, because pregnant women's immune systems do get low during pregnancy. But it also helps to pass that immunity on to baby through breast milk and through the placenta. And so babies don't get their flu shots until 6 months. So that would help them.
That's the one way that it can be potentially passed
Yeah.
safely to the baby. Yeah. Alexa's also asking about that issue with the strains, because it's not just a set formula that they're passing out every year. They have to figure out which type of flu that might happen.
Yeah.
That's pretty amazing that they can
Yeah,
do that.
it's pretty amazing. The World Health Organization does a really great job of surveying across the globe what strains are making people sick. So, you know, we're here on the Northern Hemisphere and we're getting our flu now, but the Southern Hemisphere actually gets it during the opposite times.
Right, their winter.
Right, during their winter months. So they survey what strains are going on there and the likelihood of us getting it up over here.
Does GBMC have access to the flu vaccine, and do they have clinics where you can give out shots, or is that something that people usually do through their own doctor or their practice?
Absolutely. So GBMC has a wonderful internal medicine clinic, and we provide the flu shot. And so you can just call and, you know, come in and get your flu shot. But, you know, the flu shot is available pretty much everywhere. Pharmacies, pediatrician offices, they have different flu clinics when you can bring your child in, and for certain days, certain hours, all they're doing is giving out the flu shot.
As someone who treats people who had the flu, do you find yourself cleaning off the kitchen and bathroom countertops at home more often this time of year? Or?
You know, I do.
You know it's there.
I know, I do. Healthcare workers are kind of like the front lines of a lot of these infectious diseases. And so I have a 3-year-old at home, and so I do everything that I can to just like always be doing hand hygiene, using soap and water, alcohol-based sanitizers whenever I can, and totally disinfecting everything. If I'm sneezing, I disinfect the countertops where he is, because I don't want him to get it.
Right.
But he gets his flu shot every year, so he should be okay.
But if the doctor's cleaning off her countertops
Yes.
a little bit extra this time of year, probably good advice as well.
For home and school, yeah.
For home and school and office.
And office.
Potentially,
Absolutely.
wherever everybody's going to be coming together with the flu. Anything else you want to say about this year's flu season, or you think that the health system is ready for it as far as what you've seen in previous years? And the main advice is to really get that vaccine, right?
Yeah, and I would just stress that there is a high-risk population of patients that we talked about earlier, children, especially under 6 months, who haven't gotten the vaccine, people over 65 years old, patients with diabetes, chronic illnesses, people on chronic steroids, transplant patients, HIV patients. That is the flu shot is almost, necessary for them, because they are the folks who, if infected with the flu, have a higher risk of getting these severe complications, causing hospitalizations and even death sometimes.
Right, because they're vulnerable if they were to contract the flu
Right.
this winter. Yeah. Wow, Dr. Jasmine Manley, thanks so much for coming in. It's been a pleasure talking
It's a
to you.
pleasure talking to you
Here on the
guys.
Day of Answers at WMAR 2 News. There's another Facebook Live coming up later this afternoon at 3 o'clock with another expert from
Yes.
GBMC. And then also during the 5 o'clock newscast tonight, we'll have another one for you. So keep sending those questions in on the WMAR 2 News Facebook page. And Dr. Manley, thanks so much.
Thank
And
you.
thanks to you for watching.
Thank
I'm
you,
Christian
guys.
Schaefer. Have a great day.